It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question from our readers, and the question last week was, my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? And that was part 1 of this series of questions. You can check out last week's questions by clicking on the link below this video where you find the written version of this blog. In this week's episode of Your Questions Answered, I want to answer the next question from our client Robert. And those are excerpts from email counseling and consulting sessions with me. And the question Robert asks this week is part 2 of my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? And that's part 2. Robert describes his mother's situation as follows. So Robert writes, Hi Patrick, thank you for your response and for your insightful and thoughtful answers. My first question today is, my mother basically has been under for about 7 days now and has not woken up. The MRI and EEG show no issues, so there hasn't been any brain damage. How common is this? She's got some factors that are likely extending her time being unconscious, including age and the fact that she's known to take a while to get over sedation. In Brazil, it took her 4 days to get over the sedation and finally open her eyes and be able to sit up. My second question is, today she took another step backwards. She's not responsive at all anymore. What do we need to expect next from your experience? My next question for today is, the doctors have talked about extubating her and turning off the ventilator. This was yesterday when she was doing a little better. Their claim is that it's better to get her off the ventilator and reduce chances of infection. They are also talking about a tracheostomy. I think one of your web pages advised waiting until the patient has woken up before extubating and taking off the ventilator. Given the context that I mentioned, do you think that still applies? Another question that I have is, if they do extubate, and extubation means the removal of the breathing tube, and they do turn the ventilator off and for some reason she's not able to breathe on her own, how quickly does a tracheostomy need to be done? And my last question for today is, what discretion does the family have in terms of how long the hospital waits for her to wake up? Is there some point at which they just give up and cease life support? Many thanks from Robert. So here is my response. Hi Robert, thank you for the update and thank you for sending through your questions. So let's look at your first question where you ask, my mother has basically been under for about 7 days now and has not woken up. The MRI and EEG shows no issues, so there hasn't been any brain damage. How common is this? She's got some factors that are likely extending her time unconscious, including age and the fact that she's known to take a while to get over sedation. In Brazil, it took her 4 days to get over the sedation and finally open her eyes and be able to sit up. So here's my answer. 7 days and not waking up is nothing in intensive care terms. Not after major abdominal surgery with sepsis and not after what your mother has been through in recent weeks. I know how frightening and scary it is for families in intensive care to watch their loved ones go through this, and I know how helpless and frustrated you must feel for watching your mother going through this. I'm so glad they have done the MRI and EEG to rule out brain damage. Therefore, this delay in waking up is very common. Again, it would be very good to know what sedatives and opiates are painkillers, your mother is currently on. Furthermore, this massive event to your mother's body and body system with a critical illness will cause a delay in waking up as well, because her body will need time to rest and heal. You are also describing that it took your mother 4 days to get over the sedation in Brazil. This is nothing in the bigger scheme of things, and sometimes critically ill patients in intensive care can be in an induced coma for many weeks, and yet they can still wake up. Therefore, time, patience, a positive environment, nurturing and getting perspective around critical illness, sepsis, and induced coma are important to deal with the frustrations of it all. Keep also looking at the ebook that you've purchased. Most of the information and timelines around waking up will be in there. The ebook is the 10 answers to the 10 most frequently asked questions when your loved one isn't waking up after an induced coma. So your second question, Robert, is, today your mother took another step backwards. She's not responsive at all anymore. What do we need to expect next from your experience? Again, Robert, abdominal surgery and sepsis can be very challenging. It's not uncommon that, as you have described, patients have various forms of antibiotics and yet they still don't get the sepsis under control. We have been working with a client since November last year who was in ICU for abdominal sepsis, and the infection is still not clear, but the client's family member has finally, after 7 weeks, come off life support and out of intensive care. Therefore, again, patience and a positive environment can sometimes be one of your biggest assets in all of this. And again, the combination of sepsis with low blood pressure and the sedatives, opiates, would be causing your mother to not respond. So your next question for today is, the doctors have talked about extubating her and turning off the ventilator. This was yesterday when she was doing a little better. Their claim is that it's better to get her off the ventilator and reduce chances of infection. They are also talking about a tracheostomy. I think one of your web pages advised waiting until the patient has woken up before extubating and taking the breathing tube out and taking off the ventilator. Given the context that I mentioned, do you think that still applies? I know, Robert, your mother has gone backwards before you wrote this question. However, getting her off the ventilator rather sooner than later should always be the goal. Therefore, a clear yes to extubating her as soon as clinically possible. Getting your mother off the ventilator is definitely reducing chances of another infection, as the length of time on a ventilator is simply increasing the chances of a chest infection or a pneumonia. A tracheostomy is definitely an option if your mother can't come off the ventilator, and I will explain to you in detail in a moment why. A patient in intensive care definitely needs to be awake before the breathing tube can be removed, no question. If they are not awake, they can't maintain a safe airway. But it should always be the primary goal to extubate as quickly as possible for the reasons mentioned. Your next question for today is, if they do extubate and they do turn the ventilator off, and for some reason she's not able to breathe on her own, how quickly does a tracheostomy need to be done? If, for whatever reason, your mother can be extubated and is unable to breathe on her own, she will need to be reintubated, which is basically the reinsertion of the tube back in the throat. And then they can do the tracheostomy within the next usually 24 to 48 hours. Sometimes I do believe it's good to have a trial extubation first, because then one can be sure that a tracheostomy is the right next step. A tracheostomy in this day and age is a quick 30-minute procedure for an experienced intensive care specialist or surgeon, and it can often be done in intensive care, unless they expect complications, of course. A tracheostomy will give your mother time to wake up in her own time, because as soon as a tracheostomy has been done, pretty much all sedatives can be ceased and opiates can often be reduced, as a tracheostomy usually is not painful. It's also a lot easier to wean a patient off a ventilator with a tracheostomy compared to a breathing tube, especially in prolonged critical illness. I have also put some links in the email and the article about when to do a tracheostomy. You can check them out if you're scrolling down below this video in the written version of this blog. So there's 4 articles and videos that are linked to about when to do a tracheostomy, what are the risks and benefits of a tracheostomy, for example, and why a critically ill patient in an induced coma needs a tracheostomy in intensive care, and also how long should a patient be on a ventilator before having a tracheostomy, and how long can a breathing tube or an endotracheal tube stay in. All those links you find in the written version of this blog below this video. And coming to your last question for today, Robert, what discretion does the family have in terms of how long the hospital waits for her to wake up? Is there some point at which they just give up and cease life support? Well, if your mother doesn't wake up, there will be a point where discussions need to be had around how long is too long to wake up. But then the next step is to do a tracheostomy first to give her the time to wake up in her own time. At this point in time, with everything that you've shared, there is nothing that I haven't seen or haven't witnessed before. Yes, your mother is in a critical condition, no doubt about it. And yes, she could deteriorate as well as take her time to wake up. However, the point to give up is, from my perspective, a long time away, even though she remains on multiple forms of life support, such as mechanical ventilation and inotropes or vasopressors for low blood pressure. It's the nature of intensive care and critical illness. There are often differing views about what might be, quote unquote, in the best interest of a critically ill patient and their family. We can certainly help you to get best, standard, and prolonged treatment for your mother should the intensive care team be of the view that is contrary to your and your family's wishes. We can help you position your mother's diagnosis, prognosis, as well as her care and her treatment, should the intensive care team be of a differing view and wanting to cease life support prematurely. Every hospital or intensive care unit, as well as every state, has policies, guidelines around when and in what circumstances life support can be withdrawn and who can make this decision. Again, we can help with that if it came to this point. As for now, especially with abdominal sepsis, one of the next issues or complications that may occur if your mother continues to be septic is acute kidney failure. And then there is a high likelihood for your mother needing hemodialysis, but hopefully she'll just improve. It sounds to me like she has a very supportive family who is prepared to go the extra mile. Again, we can help you with advocating for your mother if she deteriorates, if the intensive care team is having conflicting views with your views. For now, from everything that you are describing, your mother is in a normal situation for intensive care or critical care terms, given her current clinical picture and circumstances with the information that you have given me. And I think that everything that should have happened thus far has happened. I hope this helps, Robert. Please let me know if you have any other questions or if you need more clarification. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.